Recognized Ms. Malliotakis from New York for 5 minutes of questions.
Thank you, Mr. Chairman. I think many of us in the committee are really disturbed by revelations to this committee that there were officials at NIH that deleted government records, they deleted personal, or they used personal information, personal emails to communicate and circumvent freedom of information laws. So I just had a couple questions about that. Dr. Fauci, did you delete any emails or records related to the Wuhan lab or the origins of the virus?
No, I did not.
Okay. Dr. Morins said in a May 2021 email, he indicated that he was connecting people to you in a, quote, secret back channel. Do you know what he was referring to?
I don't have any idea what he's talking about. There is no back channel at NIAID.
Okay, there is, he also said in another email that there is no worry about Freedom of Information Act. I can send stuff to Tony on his private email. Did you communicate with anyone relating to anything regarding NIH or with Dr. Morins on a private email?
I do not do government business on my private email.
Okay, so have you communicated with Dr. Morins via private email, even if it was not necessarily your definition of government business?
It might have been because, as I mentioned in my opening statement, one of his functions is to write chapters, medical scientific chapters with me, so it is conceivable that I communicated with him on my private email when we were writing a chapter, and that was not official business.
What about Peter Daszak?
No.
Okay. I just want to clarify for the record, because today you testified that you did not suppress the lab leak theory, yet in the past you have said, quote, it is a distortion of reality, unquote. You've said, quote, I've heard these conspiracy theories, and like all conspiracy theories, they're just conspiracy theories. That's what you told the American people. And so would you like to clarify what science were you following then versus now?
Yeah, no, I've also been very, very clear and said multiple times that I don't think the concept of there being a lab leak is inherently a conspiracy theory. What is conspiracy is the kind of distortions of that particular subject, like it was a lab leak and I was parachuted into the CIA like Jason Bourne and told the CIA that they should really not be talking about a lab leak.
Thank you.
That's the conspiracy.
Appreciate that. Dr. Fauci, how much have you earned from royalties from pharmaceutical companies since the pandemic began in 2021?
Zero.
It says NIH scientists made $710 million in royalties from drug makers. You're saying that you did not receive any of the $710 million.
On COVID, I received, I think, $122 for a monoclonal antibody that I made 27 years ago.
Okay, so just in general, though, how much have you received, not related to COVID, just in general, how much have you received in royalties between 2021 and 2023?
I think none.
Okay, so somebody received the $710 million.
Somebody did, but not me.
You didn't receive any royalties. Okay.
I mean, I see no royalties associated with COVID. I mentioned.
I said.
You know, I want.
No, I just said.
I'm on the record, and I want to make sure that this is clear. That I've developed a monoclonal antibody about 25 years ago that's used as a diagnostic that has nothing to do with COVID, and I receive an average of about $120 a year from that patent.
Okay, but the bottom line here is that scientists at NIH did receive $710 million in royalties, and I guess my question is, don't you think that if these experiments are made using American tax dollars, that any of those royalties, this nearly billions of dollars, should be going back to the American taxpayer, not in the pockets of the scientists? Do you believe that's a law that we should consider changing?
If you want to change the patent laws and the Bayh-Dole Act, then go ahead.
Okay.
But that's not for me to say.
I'm asking your opinion. Okay. Well, anyway, moving on, I just want to say that, we know billions of dollars have been funding these animal experiments, both here domestically and in foreign lands. I'm very troubled by the cruel, horrific animal research that has been done on U.S. land and in foreign laboratories. Taxpayers are footing the bill for billions of dollars. These beagle puppies that have their throats slit, they're being injected with ticks, they are murdered after just a few months, piglets, rabbits, you name it. FDA is saying we no longer need to be testing human medications on animals, that there's other ways to achieve this. Can you comment on that, if it's time for the United States of America to be moving on from these cruel animal and horrific costly tests?
I'd be happy to comment, but I'm puzzled as to what that has to do with the origins of COVID.
Well, I have a question about it,
Okay,
and you're
I'd be
before
happy
this
to
committee,
answer
and
it.
it has to do in general with the amount of waste of tax dollars that NIH is using.
Well, the animal experiments that are conducted by and funded by NIH go through strict regulations of the proper use of animals in research. So I'm not, Congressman, with all due respect, I'm not trying to be confrontative. I'm not sure what you're talking about, but the experiments that the NIH funded go through strict regulatory processes of the treatment of animals, the humane treatment of animals.
Well, they're not very humane, and I will say, as the former director, you signed off on these experiments, and so my time has expired, and we will.
Well, I signed off on them because they were approved by a peer review.
Now recognize Ms. Dingell from Michigan for 5 minutes. Ms. Ross from North Carolina for 5 minutes of questions.
Thank you, Mr. Chairman. I want to thank you, Dr. Fauci, for your voluntary testimony today, also for so much grace in your 14 hours of testimony. And I, again, want to thank you for your service and your patience. It's truly remarkable. Because it bears repeating, let me just remind everyone that after 15 months, my Republican colleagues' extreme allegations against you remain unsubstantiated. Unsubstantiated. And now, during your two-day closed-door interview in January, you discussed a number of topics regarding the public health response to the COVID-19 pandemic, some of which we've touched on briefly, but I just want to dive in a little bit deeper here. For example, you discussed both then and here with Congresswoman Castor the recommendation that we maintain 6 feet of distance between one another to reduce the spread of COVID-19. And you discussed how social distancing recommendations were developed, that you yourself didn't pick this 6 feet, and it was just really kind of a guideline in the moment. In your view, though, do social distancing recommendations and other public health measures to reduce transmission save lives?
Definitely.
Okay. I'd also like to go back and take a deeper dive into the COVID-19 vaccine discussion that we just had. And you were also asked about that during your interview in January. In the Select Subcommittee, we've heard suggestions that the vaccine was ineffective because of breakthrough infections that occur after vaccination. We just heard about that right here. But as I understand it, perhaps the strongest measure of COVID-19 vaccine's effectiveness is the reduction of severe disease and death, not necessarily getting a milder form of COVID. Could you talk about that a little bit?
Yes, it's very clear that when you're dealing with many vaccines, but particularly when you're looking at COVID, as I mentioned, and I'll repeat it quickly for you, that early on there was a degree, not as much as against severe disease, of protection against infection. Unfortunately, that protection against infection, which is related to transmissibility, waned rather rapidly in a matter of months. What has stood firm, well, much better than transmission and much better than infection, is the ability to prevent someone from hospitalizations and deaths. And in fact, the curves, Congresswoman, are stunning. When you look at the deaths and hospitalizations of people who are unvaccinated, it's like this. When you look at the deaths and hospitalizations for people who are vaccinated and boosted, it's like this. The difference is profound. When you're dealing with infection, again, less so because of the waning of protection against infection.
Well, and that was also confirmed by a Commonwealth Fund December 2022 report that which came out 2 years after the Biden administration's effort to get COVID-19 vaccines in arms, and your effort too, that it prevented more than 3 million deaths and averted 18 million hospitalizations. And that came out in 2002, but it seems to corroborate what you're saying.
Indeed, and $1.15 trillion in healthcare costs.
Thank you for that add. One pillar of the vaccine requirements was to have an increased uptake in the COVID-19 vaccines, and that at the time was supported by leading physicians, including the American Medical Association, the American Academy of Family Physicians, the American Academy of Pediatrics, and more. Were the vaccine requirements a clinically sound tool for improving uptake of a safe and effective vaccine?
Yes, you would like people to get vaccinated voluntarily and realizing the important effect on it. But the fact that people were vaccinated by whatever their motivation was clearly saved many, many lives.
And just with the 17 seconds I have, what steps can public health officials take to bolster confidence in these life-saving interventions since there has been so much misinformation circulating?
That's going to be very difficult, Congresswoman, because there is so much mis and disinformation around that we've got to do a better job of reaching out and trying to get the correct information. But that's difficult when you have a very energetic group of people continually spreading mis and disinformation about vaccines. We've got to be more proactive in putting out the facts and the data and the information that's correct.
Thank you very much for your testimony, and I yield back.
Now.